Okay, my name is Mohamed Saad. I am an assistant professor in Biomedical Engineering Department in Faculty of Engineering, Mania University, Egypt. The title of my talk is Could Al-Zahrawi be considered a biomedical engineer? First, I would like to introduce biomedical engineering. Biomedical engineering is anything that helps the physician to perform diagnosis and the treatment of diseases other than his own hands and his own experience. This is the simplest definition of biomedical engineering. The resource, this talk is part of a paper published in IEEE Pulse in 2016. I'd like to give you. Okay. It is about introducing Al-Zahrawi, and he's intensively introduced in this conference. Okay, I will give a hint about the surgical instruments that was almost invented by Al-Zahrawi in different disciplines of medicine, like obstetrics and gynecology, urology, pediatrics, cauterization, fractures and dislocations, ear, nose, and throat, ophthalmology, dentistry, aneurysm treatment, bleeding control and wound healing, surgical suturing, cosmetology, pharmacology, and the concealed knife in general surgery. First, in obstetric and gynecology, he invented the vaginal speculum to help in the extraction of a dead fetus. It is equipped with a screw arrangement for unscrewing its spoon-like branches to widen the genital tract. You know, the screws are screwed in the opposite directions, two different directions, to increase or decrease the distance between the two spoon-like branches, to widen the genital tract, to have a large field of view to inspect inside the uterus. Okay, then he applied the cephalotribe. It was used to crush the dead fetal head and compress it to be visible in dimension in the uterus. It was not for live delivery. It was in the case of a dead fetus only. Then the hook with two horns was used to extirpate of the dead fetus from the uterus, to get the dead fetus out of the uterus after crushing the head, the biggest dimension inside the uterus, and then getting it out. In urology, he was the first inventor of the straight caster for urinary bladder irrigation. A double thread was used to hold a piece of cotton which was inserted in the beaker-like end of the caster. After reaching the bladder, the cotton plug was withdrawn through the tube to irrigate the bladder, and it was in appropriate dimensions to be inserted in the urinary system. Also, he was the first to invent the syringe, but only for the urinary bladder. The syringe was used for the injection of medications, consists of long, narrow cannula and a broader straight cylindrical barrel and a copper piston. Like syringes nowadays, the piston is pressed to deliver medications in liquid form to the bladder, and it resembles the nowadays syringe greatly. In pediatrics, he used the scissors in circumcision of boys. The medical uses of scissors is not, there is a doubt that the Zahrawi, he invented the medical scissors, and there is a doubt that the other Arabian surgeons used it before him. The shape of the scissors is flattened, sharp, straight, and with the pivot tempered. He recommended that the handles and the blades of the scissors should be equal in length to send the correct sensation to the holding fingers. Also, he invented a ring-shaped cautery used in treatment of lower area of lumbar vertebrae of children. Also, it can be used for adults with other dimensions appropriate for them. This area of a child's body is associated with spinal column back pain. In cauterization, Al-Zahrawi flourished the field of cauterization greatly. He explained the advantages of using metal cauteries over caustic drugs. The amount of cauterization produced could be precisely judged when using metal cauteries. Also, the neighboring tissue will inevitably damage when using caustic drugs. Also, in cauterization, Al-Zahrawi demonstrated the disadvantages of using gold as a material for cauteries. His criticism: gold may liquefy on overheating. The right degree of heat that should be transmitted to gold cannot be attained due to its reddish color. Gold cools down very quickly. He noted that iron is better for cauteries. His preference is in line with the modern knowledge. The melting point of iron is 1535, while for gold is 1063. There is a difference about 500 degrees centigrade between gold and iron. Fractures. It shows the dislocation in the backbone and how it could be treated using this technique. Okay, in ear and nose and throat, he used the guillotine for removing swollen tonsils with curved ends, and he used a gatherer with curved extremities for extracting a foreign body from the throat and esophagus. And he preferred that the patient decide the right place for the of the foreign body, that he can feel it more than the physician, but under the supervision of the physician or the doctor. Also, he invented the tweezers for removing foreign bodies in the auditory canal inside the ear. In ophthalmology, he invented the crested shaped cautery for cauterizing the roots of the hair on the eyelid when the eyelashes grow into the eye. The roots of the hair on the eyelid were cauterized to stop cornea irritation. And all his inventions in cauteries were appropriate to the place which will be applied on. The Cushing needle or the cataract needle he used for cataract and hypopyon. These videos were provided by the, I think, IPTAV organization in Turkey, organized by Professor Dr. Fuad Sisgin, Rahmatullah Ali. It has a fine end to be applied on the water inside the cornea. That's it. In dentistry, he invented different types of tongs for extraction of teeth and removal of tooth fragments, as you can see. Also in dentistry, Al-Zahrawi used a variety of raspatories, instruments for scraping, for removing tartar. He was aware that tartar forms a compact group and causes periodontal disease with a wide variety of shapes. Aneurysm treatment, he used single, double, and triple hooks for lifting and twisting the vessels. Also, he used the scalpel for making an opening in the infected artery. In bleeding control and wound healing, he used natural substances and their effects in the management of surgery described in Al-Tasrif book. In this table, we can see its common name, scientific name, and its effect. He used the dragon's blood. Its effect: wound healing and antimicrobial, sarcocola, wound healing, mira for wound healing and antibacterial, aloe, wound healing and antimicrobial, gum arabic tree, antibacterial effect. In surgical suturing, Al-Zahrawi was the first surgeon who used animal's gut to suture a wounded intestine. He was aware of using a compatible biomaterial inside the human's body that the body wouldn't reject. And he says a story about discovering this way, as he has a monkey and he ate the strings of his lute, a musical instrument, and he extracted these strings as it is from his excretion. So he knows that the strings will not be affected, the animal gut will not be affected or have a harmful effect on the inside parts of the body. These strings are still now made of animal's gut. In cosmetology, he detailed perfumes stocks that rolled and pressed somewhat like roll-on deodorants nowadays. He invented perfumed sticks rolled and pressed in a mold, the earliest antecedents of today's solid deodorants and lipsticks. Also, he studied various hand creams, nasal sprays, mouthwashes, teeth whitening, gum strengthening, hair dyes, and suntan lotions. In pharmacology, he fabricated tablet molds with single doses of powdered medicines. He was the first to print the name of the drug on the tablet. He invented a box with a hole, and this hole was the medication was put in liquid form in this hole, and then it changed to the solid form. Then he weighs the weight of this dosage. If it is less than the appropriate dosage, he increases the hole in the wooden box to have the appropriate weight of each dose. And also he could write the name of the drug on the tablet using crafting also in the wooden box. So he's the first one to print the name of the drug on the tablet. Also he used silver foil to store single doses of powdered medicines so as to keep it safe while traveling or something for longer time. In pharmacology, also he wrapped single doses of drugs in catgut packs. These packs were ready for swallowing. Meanwhile, the packs were to be dissolved, releasing the medications inside the stomach. This procedure was modified until reaching modern drug capsule designs. The concealed knife. Al-Zahrawi invented a concealed knife to be applied at different places in the body. The knife was for incising abscesses, removing tumors and growths, and treating men struck by arrows, as we see yesterday by the students. The knife is connected in that form to deceive the patient, especially the child, and not to cause alarm or anxiety. The conclusions. Was Al-Zahrawi biomedical engineer? Yes, of course, advanced the applications of engineering sciences and technology to medicine and biology. He promoted the profession, providing global leadership, and he gave an example for the interaction between the physician and the biomedical engineer, but in the same person. He was the surgeon and at the same time he was the biomedical engineer. Thanks.
Thank you very much for this nice presentation. We would like to open the floor to questions for, let us say, 5 minutes. Who can ask some questions to the speakers? Can the speakers come forward and take place on our podium so that they can be answering the questions nicely? I think we heard really a fantastic overview on the work of Al-Zahrawi. It was very nice to hear a compilation of treatises and of techniques that he used as the first of our great surgeons. Let me perhaps ask first one question to the other speakers. One knows that, in fact, Al-Zahrawi was the first to include pictures of instruments and of diseases and how to treat them. If one looks at the treatise of Paulus of Aegina some centuries earlier, he was not in the possibility to add those pictures. So does one have a good idea of the instrument form that Paulus of Aegina was really also talking about in his surgical book, so that we can know what the difference was that Al-Zahrawi included in his instrumentation? Can we know that? Can we make a comparison between the instrumentation of Paulus of Aegina and that of Al-Zahrawi?
That's exactly what I have studied, because Paulus of Aegina gives the description, but there are no drawings of instruments in classical books, in the Greek Roman books. We know the instruments, and Paulus of Aegina obviously knew the instruments, but by the time of Al-Zahrawi, the instruments, he possibly did not see any Greek Roman instrument, because after the collapse of the Roman Empire, Roman medicine absolutely collapsed, and possibly only arrows and foreign bodies were extracted, as Kirkup said in his book on the history of instruments, surgical instruments. So Al-Zahrawi had to devise instruments according to the instruments from other Arabic authors, because other authors practice surgery, but they did not include the drawings in their books. So we don't know what he had. He refers there are many instruments, but I think he had to devise his own instruments according to the Arabic tradition and the Hindu tradition. I'm very sorry, Hindu tradition is there. And Indian instruments, there are drawings from Hindu instruments. They are the only drawings before Al-Zahrawi. So he obviously knew them, and so he had to devise his instruments, reading the Greek Roman books, but devising according to what he had at hand.
I think one of the points, I'm just going to make it a bit clear. I think the great of this conference and having people from different backgrounds is to show that this part of civilizations really fit in one area. When in Europe, we used to call it the Dark Ages. In fact, we now know it's not Dark Ages. There's plenty of shining places. Again, I like to present this as part of human civilizations being there. They always contra-influences anyway, and there's always intra-influence as well. So they took from, they criticize, they add, they absorb some. Obviously, he worked for a good number of years, 50 years, so definitely he had some idea. Even the last slide, the gentleman showed Al-Mibda', which is trying to hide it from the children, because sometimes when you do circumcision, they don't have to put a child in sleep. In fact, I'm not sure if he used the opium as opium, but I know he used something called al-murqad, which is like syrup. Some people criticize him because part of the material might not be allowed that time, but people use like sedation type. But he used the knife, which is very fascinating. You put it between the fingers, you don't choke. Obviously, he made it, he created for purpose, for what he felt this is the need for. So definitely, probably maybe use what before and add and improve and pass it on to the Renaissance as well.
Are there other, yes, please.
Thanks very much for a fascinating panel. It would be hard to speak on any doctor after this. I had a question for Sharif, but perhaps others could answer it. With the circumcision, does Zahrawi ever mention circumcision of women, Khitan of women, or is it just specifically? So it's never mentioned. Okay.
There's a chapter that in the treatise that it talks about the clitoris
reduction. What's reduction of clitoris? But what he said here, tuhur as-sibyan, it means male circumcision. He put it very clear. Tuhur as-sibyan. Sibyan means boys. Yeah. I think what he put here very clear. I tend to put in my presentation the actual source, what he said in Arabic, and put translation. I think he tried to put it very clear. This wasn't known to the previous physicians. Probably maybe he meant Galen and the other non-Muslims physician, because they'd never been using the circumcision, obviously. for religious reason. Anyway.
Yes, please.
My point actually is the fascination of what Sharif and the Dr. Saad also have said regarding the advancements of the surgical tools. So how much do we know about the infrastructure of the engineers? For example, you cited the Indian iron. Now we know that the Indian iron actually is not just pure iron. It is used in the Damascus swords, which is a compound steel, which now with electron microscopy, we know that there is nanoparticles in it to give it that strength and ability to bend as well. So how much knowledge were the engineers of the time to help Al-Zahrawi and others to choose iron rather than gold? Because this is metallurgical knowledge and engineering knowledge, not a physician knowledge.
I can't answer this.
Excuse me, in the same way, the question in the same way, I have two passing questions, because there are some authors that put in doubt that Zahrawi was a surgeon. He was only described the surgery. But it's clear that, that Professor Kaf al-Ghazal described that I made this surgery, I made this surgery. At the same time, concerning the instrument, if Al-Zahrawi mentioned that I made this instrument, or he mentioned that this instrument is used for, it's very, for me, it's very very important. If these instruments have been made by Al-Zahrawi, or Al-Zahrawi mentioned this instrument at it should be used for.
Okay, I would like to say Al-Zahrawi is very prolific scientist. His inventions and his as a engineer and as a surgeon and as a physician and as a pharmacist, I can't believe he invented all these instruments with his hands. Something like that, and he maybe gives the design and the function of the instrument. And, I think that others do in his book. I did it, I used it, this function, but it's not clear that if he has fabricated it from all its procedures, from the design to trials and errors in trials, then to have the correct surgical instrument for the right function after experimenting it for doing its job.
Mm-hmm.
That's.
You add something?
Well, well, it's clear that both Albuquerque and also Galen, that doctors devised their instruments. We don't know, of course, if they were helped by other scientists. But Galen has a text, and Al-Zahrawi says the same thing, that you should devise everything that you need according to what you have in front of you. And Galen has also a text like that, and there is a relief of the blacksmith with surgical instruments devised by doctors. That's what.
Yes, some addition. It's in some of part. There's a chapter that he talks about the metals you can put in the mouth, and there is. He says, if you put silver, it would get dark. If it is well tolerated, if you put gold, so we can be sure that the description of the some of the procedures come from the Greek and the Roman, and even from the Gallic times, and he just perfectionate the technique, or even put a little bit of modification of the treatment. He says at the beginning of the surgery of the trees, he said he do this surgery of the most common diseases that he found.
Certainly would not be, we'll close the discussion. I'm very proud that we have had a good discussion, because all our speakers were so enthusiastic that they induced this discussion, but I think we are going to take a break for the tea. One question still is possible.
Thank you very much, Professor. You know, in the hierarchy of evidence-based medicine, the highest level of evidence is double-blind, randomized, controlled trials. And the lowest level of evidence is anecdotes, personal experiences, professorial mantras. So I yesterday alluded to Al-Razi being the first to apply randomized controlled trials in the use of venesection in the treatment of meningitis. And Ibn Sina also alluded to his 7 steps of clinical experimentation. Trials with animals, then trials with human. You have to replicate your results. My question is, was there any similar clinical trials that was undertaken by Al-Zahrawi?
I'm not aware of actual clinical trials. I don't want to say this maybe because he's a surgeon. They call it surgery, it's amalul yad. So I know his fascinating book, At-Tasrif, he only focused on the last article, which is on surgery. But he did 29. I think this needs to go back, and we need to study this and produce what he said. But I'm not aware of clinical trials, as you're saying, but definitely he put lots of observations on some similar cases, and he came to conclusion on this. I feel now in Britain we work probably for 25 years, 30 years practice. The guy works for 50 years in surgery till he's 77. So definitely he had a great experience to put his practice, and many people after him. This is what I've been talking to people. I think we need to see how Al-Zahrawi's the people came after Al-Zahrawi, what they said about Al-Zahrawi, and they judge him on what he did. But answering your question, I'm not aware of actual clinical science as we in the modern medicine believe.
So we certainly will have other views in the future. Thank you very much for the audience and for all the speakers. Thank you.